Hello, everyone. I'm Leah Binder. I'm President and CEO of the Leapfrog Group. And today we are having a wonderful webinar on the issue of the Consolidated Appropriations Act and its impact on quality and what employers can do today to be ready and to put into place the provisions of this very important legislation. And with us, we have some terrific guests. We have Dave Chase, who is the CEO and founder of Health Rosetta, which is transforming health plans to drive well-being and wealth. Dave is going to present a suite of essential and free resources designed to help employers navigate the complexities of the CAA. And he's going to tell you about that when we get to him. We also have Melissa Bartlett, who is Senior Vice President of Health Policy for ERISA Industry Committee, which is leading the development, and she is leading the development of their health policy and advocacy. And she has some great insights for us on really the future of the CAA, where we are in this election year, and also concrete steps employers can take. ERIC is a employer-driven organization, so she will have lots of great insights for us as well. But basically, for any employer who is joining us today, we hope that you come away from today with some concrete tools for you to take the kinds of steps that will be most helpful to you and your business in the coming weeks, days, and years. If you have a question in the course of this, you can put it on the Q&A, which is at the bottom of the screen, and we will hopefully have lots of time to get to your questions in the course of this toward the end. In addition, we will be sending out the materials that you see today, those slides. We'll be referencing some papers, some materials, some resources, which we will make available as well. You can also just check out on Leapfrog's website. We have a CAA library page, which includes all of the resources you're going to hear about today, but also some other resources that we have gathered over the past year and a half. We've been doing this series of webinars, and you will find as well past webinars, recordings, and there'll be a recording of this one as well. So lots and lots of additional materials and some terrific presentations that we've seen over the year from some of the experts on this topic. So hopefully this will be helpful to you, and we're going to hear some good questions from you, which will help to guide Leapfrog and all of us in our thinking as we move forward with this, again, this very important new law. So let me begin. I'm going to begin with a little bit of an overview of our perspective and why Leapfrog has been so actively engaged around the issue of the Consolidated Appropriations Act. So if you could switch to the next slide. So just to level set very, very basically what this is that we're talking about, the Consolidated Appropriations Act was signed into law actually at the very end of 2020. It's really the budget, the federal budget for 2020, but it contained some very important provisions that expanded ERISA in a way that puts some very important new responsibilities really on purchasers, on employers and purchasers around how they manage their health benefits. And it includes a number of provisions that really try to enhance transparency around pricing in particular, and also quality. And it had many requirements on what employers needed to be able to do to ensure that their employees were getting the best possible value for their own investment in healthcare. So removing hidden fees and gag clauses, for instance, which we'll hear more about today. But basically, it requires, it really strengthens actually how employers are required to act in the best interest of their employees in managing health benefits. And while that is a lot that employers have to shoulder right now to comply with this, at the same time, in order for them to comply, they are required to make sure that their third parties that they work with are also in compliance. So for instance, consultants, brokers, and health plans, et cetera, are all acting in a way that will support employers in these very important responsibilities. So there's a lot to this. And so let me let me focus for my own comments on why Leapfrog in particular got very involved in this. We got involved in this because we recognized that with this strengthened provisions under ERISA, there are some very important provisions. There are some very important aspects to it that require employers to focus heavily on quality and safety. So next slide. You will find that while the CAA talks a lot about costs and transparency around costs, quality is actually an important aspect that employers are also required to monitor, in part because there's no good price for bad care. So if your employees are getting bad care, they are never getting a good value. And so in terms of being vigilant around the CAA, providing your employees with the best possible or the fairest possible value for their dollar, you're going to need to focus on quality. Now that was a take home for a number of lawyers and others that we've been working with to understand this legislation. I worked with a couple of really well-known, terrific ERISA attorneys, experts on ERISA, to develop this white paper, which is available in that toolkit I mentioned. And we set about doing the white paper to really probe this issue of how does this CAA legislation really impact quality? Does it really require employers to focus at all on quality of care, or how much does it anticipate that? And what they first started thinking was, well, I'm sure they have to do some of that. I'm not sure that this particular legislation is that focused on quality. And they came away after we had developed this paper, they came away with the opposite impression. They feel that employers should focus on quality first, that is the best possible way to protect themselves in the course of this legislation, and that there's actually quite some strong language, particularly from the Department of Labor, on the importance of quality. So there's some very strong signals that from a regulatory point of view, it's going to be very important for employers to have a strategy on quality for their employees, but also in terms of protecting themselves and risk, this is probably the first strategy, because it is the best way to convey that you are actually sort of on the side of employees, which is an important thing to convey, to be protecting yourself in a situation where there's any kind of legal action. So what we concluded in this paper, and again, it's available on our website, is that plan sponsors have to demonstrate diligence and transparency in disclosing both quality and pricing information. We know a lot about the pricing information. That's been the big focus, but the quality information also, it's available to you, but it is important to consider that as a really important piece of what your transparency strategy is in light of this law. And again, it is a major risk. It's a major way to control your risk. Next slide. So Leapfrog became very interested in this because we were founded on the principle that quality and safety should be transparent, publicly available, and that employers have a direct role to play in making information like that available to their employees and using that information to get them the best benefits. So it is directly in line with our mission when we were founded back in 2000. Back then, there were actually, in the end, there was about 175 employers that founded Leapfrog. Now thousands are involved, but at that time it was about 175. But the key employers have their logos right here, that were really the original cabal that got together of employers who said that they were very frustrated with what they were hearing about patient safety, and the fact that 100,000 people were dying every year from preventable errors in hospitals, preventable problems. And that they, despite all efforts, back in 2000, a lot of those efforts had centered around HMOs and kind of capitated health plans, but they'd had many different strategies that employers had tried over the years to improve quality for their employees. And then what they learned is that it's still not good. So they really took the approach that they were going to try something that was really what any business leader knows well, which is open marketplace, transparent open market, What about if we had hospitals and other settings, providers, publicly report how they're doing on safety and quality of care, and then we let our employees use that information to guide their decision making. And that's the fundamental of an open and transparent market. They knew, as leaders in a whole variety of industries, they knew this works. This makes products better and more cost efficient. Competition is a positive, healthy trait. So they wanted to see more of that in healthcare, and that's why they formed Leapfrog. The idea of Leapfrog was, let's publicly report. Let's ask the hospitals to voluntarily give us information, and let's publicly report on their safety. Let's set the highest possible standards for quality and safety, and let's report on whether the hospitals are meeting those standards. And that, again, is the way they felt they were going to get the best value out of their enormous investment in the health benefits of their employees. And they were going to use principles of purchasing, by the way. So right now, or in many cases, there are many employers who spend a lot more time figuring out, let's say, the purchase of office supplies and comparing value propositions among different competitors than they do on comparing the value of different providers that are available to their employees. So that's the principle of Leapfrog was, you have a direct stake in this, not just through your third parties, but directly. You as an employer have a direct stake, life and death for your employees, on what you are paying for when you buy your health benefits. Next. So what Leapfrog has done over those 24 years, I won't go into any detail except to say that we publicly report by hospital and by ambulatory surgery center on whether or not they meet our very high standards for safety and quality. We do it in a way that is simple and usable by any employee. The simplest possible one is our safety grade, hospital safety grade, where we give a letter grade to every general hospital in the country on how safe they are for their employees. So A, B, C, D, or F, we give all grade levels. You can look at it in a whole variety of ways, including drilling down to see how we got there. We use very sophisticated measures of safety, and we show you which ones we use. We also report on things like maternity care. You want to know C-section rate by hospital? Leapfrog is your source. All of this is because of employers. This is by, for, and about employers for their employees. It is designed to be the issues that matter most to employers, because that's who's driving our work. And it is entirely, it's about not having every single employer have to go out and figure out how to collect all the data. How do you get it right? The C-section rate that's comparable, blah, blah, blah. Every single employer doesn't have time to do all of the work that's involved in that. They can rely on Leapfrog to do it, then use that data. And in return, you go out and get the data and ask the hospitals for it. Next slide. We have also done some very interesting analyses and on death and excess costs related to problems we've observed in different hospitals, including problems with errors and accidents and injuries. This is an example of a calculator. It's free. If you want to go on our website, you can try it out. Next slide. This is one employer found in doing the calculator that they had an estimated 7 avoidable deaths among their covered lives last year. Next slide. And also spent an extra $21 million as a result of the errors and accidents that we can estimate based on this calculator. This is just one example of the kinds of tools we've been able to develop over the years. Again, all for employers and all free. Next. So here's what we say as we look from a lens of quality at the CAA, what employers should be expecting from your TPAs and consultants. One is that they are selecting their network based on transparent quality and cost data. So it is not enough for them to say to you, oh yeah, we just do, here's your network, that's it. And yeah, it's all based on quality, but don't bother yourself on why. You need to know why. You're going to be accountable for that. It does matter a lot. And you can get this data on your own, but they should also be providing it to you. That your deductibles and copays are structured for affordability, that your contracting principles are aligned with your employees' interests, which is almost always going to mean, are they based on quality and safety. People do not want to go to a place that has an extremely high infection rate or a lot of errors in medications. Nobody wants that, none of your employees. You actually, thanks to Leapfrog, which you as an employer are part of why we have Leapfrog. You should be proud of being part of Leapfrog, that you have the capacity to find that out. Are they actually acting in our interests? And you have a way to check and say, wait a minute, I don't think that hospital or that ambulatory surgery center or that provider should be in this network, because looking at this data, I don't see how they're actually acting in the interest of employees. So you have that, you can check it. And finally, make sure that your third parties are making that quality and cost data available to your employees in an accessible way. There's a lot of really inaccessible ways to make it available. Make sure it's accessible. And that all of that will protect you in many respects from some of the risks ahead for employers who are not in full compliance with this law, which is a hard one to get in compliance with. And it will also give you peace of mind and give you better health benefits and probably save you some money in the meantime. So we at Leapfrog feel strongly that every employer needs to have all the tools that they need to be able to be ready for what we're going to see ahead with this very important law and what we've seen already from this very important law. Next slide. Document your process, make this marketplace available to your employees. The tools are there thanks to you as an employer, having founded not only Leapfrog, but a number of other important initiatives that allow you to have those tools, use them. Now's the time. With that, I'm going to turn it over to my friend, Dave Chase. As I said, he is the CEO and founder of Health Rosetta. He is transforming health plans. He's actually transforming the entire world. He's one of the boldest and most innovative leaders who are out there. So I'm so excited to hear from you today about some of the incredible tools that you're making available.
Well, thanks so much. I mean, we've always had, Leapfrog and you, and we've just held you in such high regard. It's so important. And, the best article that I've read that really heightened the awareness on this was written by Leah in Forbes, where I modified the headline here a little bit. This federal law will completely overhaul company benefits. Nobody is ready, was what the title was. And our point here today is some are ready. And so what we're doing is open sourcing proven approaches here and resources that are drawn from those who have been ready. And as I get in here, I like to ground myself on who we serve every day and where the need is greatest. The folks here are all real people that are in the plans that our community supports. And, you have a situation where I don't know of another law where the more compliant you are, the more the employer and employee benefits. I'll go into a little bit more detail, but, a couple examples, one, a CFO that when they implemented these approaches, the bottom line impact, he said we would have had to increase top line sales revenue for the company overall 25 to 30% to have the same bottom line impact. Another company in Florida, which is home of the 40% of the most price gouging hospitals in America are in Florida, so it's not an easy setting. They've cumulatively saved $540 million by taking really smart approaches that I'm going to talk about here. And just to expand a little bit on why the CAA came into being is we have a failing system. The math doesn't work. 50% of the workforce is making less than $60,000 a year, and it's typically costing about $15,000 per employee per year when you consider, family members and whatnot. Extremely high deductibles are becoming more and more common. 56% of households don't have $1,000 on hand. So there's so many people who are functionally uninsured. Their life savings or their available savings are less than their deductible. And where we really resonate with Leapfrog is very high rates of misdiagnosis as well as preventable medical mistakes. And I have had my own personal journey with a friend and the devastating impact on that. And, you know, it ranges from 20% in cancer to 67% musculoskeletal. And then just access is poor, long waits, limited availability. When it's all said and done, 30 years of wage gains have been stolen from the working and middle class, because it's not because employers are stingy, they're spending a lot more money, but it's all and then some gone to an underperforming healthcare system. And you know, preventable medical mistakes are absurdly high. You know, by the end of the decade, just with the Medicare population, we're talking about here, but there's been a study on it. It's expected to be one of the 10 leading causes of death in America is just the Medicare population, the cost of medications. And so we have a lot of people. Obviously, a medication doesn't work if people don't fill the prescription. That's because of cost. And overwhelmingly, medical bills are the number one driver of debt and bankruptcy. You have 100 million Americans in debt to the healthcare system today. That was Kaiser Family Foundation news. So it's really failing quite miserably, but it doesn't have to. And as I said, the more compliant you are, the more this is what happens, and this is what happens in our community. And we've been at it several years. The people who we modeled it after have been at it for decades. There are pockets of success where literally spending 20 to 45% less per capita. We don't believe in putting in barriers to things that work. We have really goofy design plans where we put barriers up to like primary care and physical therapy. Lots of evidence they work. And then it's an all-you-can-eat buffet, unlimited corporate credit card for going to low quality, high-priced hospitals. So smart care, plan design with great care navigation, centers of excellence. These are the sort of things that will bring tears to your eyes. People who are terrified of the healthcare system, which is about half of Americans are afraid of the healthcare system because of cost. They can suddenly afford medications and surgeries and things like that. And it really reopens the door to the American dream that's been crushed by healthcare. I mean, that was the title of my TED Talk. Healthcare stole the American dream. Here's how we take it back. And we've been doing it. So employers like this, Pacific Steel and Recycling, they were spending $8 million on health benefits for their employees 10 years ago, expected to be spending 12 million today. Last few years, after they improved benefits, improved quality, they've been spending 3.5 to 4 million. That's the CFO quote I mentioned earlier, very dramatic. A little larger organization, one of the originators of this, Rosen Hotels, that's cumulatively saved all this money, really has focused in on great primary care, great quality, incredible impact. And then you have 32BJ, a very large union, about 200,000 members. One of the things they did was they removed one of the low value hospitals in their preferred network. And just that one action, they saved over $30 million a year. And it led to an unprecedented one-time bonus of $3,000 for the employees and the lowest, basically the best scenario in terms of health planning increases, and essentially none. And we sometimes shorten Health Rosetta to hero because we think these people are heroes. And one of the things that really centers us, it's our purpose we call the Health Rosetta dividend. It's been well known for a long time. 30 to 50% of what's spent in healthcare is waste. Our purpose is repurposing that waste. This is what these organizations do. My TED Talk talked about Rosen Hotels, incredible story. Encourage you to read that. But these are things that companies are doing today, fully funding college education for their employees and their employees' kids. That's about $250,000 pop. That's what Rosen's done. Adding back dependent coverage, some climate-related companies funding home solar. Most common thing is just raises and bonuses that actually mean something. Don't get all eaten up by either premium increases or, premium, deductibles through the roof, subsidizing healthy food, funding daycare. These are things all very possible when, I say healthcare is not expensive. The clinicians only get about a quarter of every dollar. What's expensive is profiteering, price gouging, administrative bloat, fraud, and some inappropriate care. These organizations choose to minimize that. And I'd really echo what Leah mentioned. When you pursue quality, you get the cost savings for free. And that's what we found over and over. And we invest a tremendous amount in redesigning health plans and specifically contracts. So you're not prevented from guiding people to the highest value care. There's a lot of contract language that prevents that. If every company did what these companies and unions are doing, it would be like a recurring $500 billion stimulus into the economy every year. And so bringing it back to Consolidated Appropriations Act, the other thing that's important to mention is there's the Transparency and Coverage and Transparency and Pricing Executive Order. They came in, they're different things, but they came in at the same time. Many experts believe you take those as a pair, it's the biggest change in employee health benefits since 1943. And we have now the biggest chunk of the workforce are millennials. By the next 3 or 4 years, 75% of the workforce will be millennials and post-millennials. Most health plans in corporate America were designed when the greatest generation and boomers were the primary workforce. There's very big shifts happening. Essentially, a new healthcare economy is emerging. And on the current trajectory, if we don't fix it, this was out of very well sourced, out of Catastrophic Care by David Goldhill. Looked at basically average millennial, he called Becky, half of their lifetime earnings going to healthcare. And this assumed that healthcare inflation only grew at half the rate of regular inflation, which obviously it goes faster than that. I don't think this is going to happen. I think that they're going to demand something different now. The oldest millennials, I think, are 43 now, increasingly in decision-making authority. So we're seeing big changes. And then on the legal front, this is a map that I've created on Google Maps. You don't want to be on this map. There's 26 pins so far. These are already employee class action lawsuits that have been filed, or there's ads by the class action firms targeting employees in this company, in those companies. It hits almost every federal district. And these are all real companies here. Some of them you can see the names. And so it's a real concern. I've been writing about this since 2016, 2017. This is one of the chapters out of this book. I'll have a URL I'll share. We can download this book for free, or an executive summary of it. And it's really changing. We just saw the third employee class action suit filed this week, and changes are afoot. But Leah mentioned how many organizations are putting more focus in on office supplies than their health plan. And we think it's time for a second opinion on your plan. This particular pencil has over 54,000 reviews on Amazon, and 20% of the economy, there's not been an objective market value of a health plan. That's one of the things that we sought to fix. And so it took us a number of years to do this. And what most organizations have been doing is driving down the healthcare road, looking in the rearview mirror at claims. Kind of interesting, but given high claimants vary so much year to year, you want to have something that's predictive. So we put that to the test for a number of years. And now we have what we understand to be the 40 most important questions an employer must ask. And we have 8 components in our blueprint. Basically, you think of it as you get a diagnostic code or diagnostic score, 0 to 100. We're very tough graders, but why shouldn't we be, given the lives and money on the line? And then we give you a prescription. It's about a 30-page report. If you have a shortcoming in this area, here's why you have that shortcoming. Here's how to address it. And we see organizations, including ourselves, we're a tiny little employer. We have a lot fewer options available to us. And we bumped along at like 42, which was as much as we could do, given our size, which is actually a pretty good score. Anything above 50 in our world is actually pretty darn good. Fortunately, the category is maturing. We're able to get over a 90 now. And so that's possible for every organization. And so what we've wanted to do is, if you look at the health outcomes that happens when you have great primary care, when you send people to A-rated hospitals, centers of excellence, if you could put it into a pill, it would be the blockbuster drug of the century. I think any that, could be a cancer cure. I think anybody that had that kind of cancer cure would share it. We have that. We feel like we need to share it. And so we found, as we studied employers over the last decade, what led to success was great procurement practices lead to great contracts. And then you've got to verify that that contract's being upheld. And then it's this virtuous cycle of improvement. And so we did, and I'm going to talk about it, is provide resources on that. And so there's both the carrot, I mentioned, incredible bottom line impact, not just for the company, but the individual, the employee, really remarkable impact. And then there's the stick, right? We do have those lawsuits rising. The ERISA attorneys have told us that they've seen more activity from the Department of Labor in the last 12, 18 months than the prior 20 years when it comes to health plans. So that is the stick out there. We like to focus on the carrot, and because we spend a lot of money, we should get something great. And so we have begun the open sourcing process. So one of the things is around the consultant you work with. There's some real issues there. I'll touch on that in a minute. Available now, if you go to this URL, healthrosetta.org/open source, share some of the logic. One of the things in the Consolidated Appropriation Act was a gag clause prohibition. This is a duty that employers have to sign that. There's some challenges there Melissa will probably talk about. And then we have some of these beta resources. We have an event coming up next month in DC where we're going to release these other things. So we'll have this RFP template for selecting what is a really critical decision, who you're working with, or you should go through it every 3 years to make sure that you're getting the value you need. And then we're creating field guides to better packaging of some of what we have out there, some new resources. The field guide gets into those 3 things: procurement, contracting, data use, rinse and repeat. And then we're also releasing technology. This has been a multi-million-dollar investment to be able to ingest claims data and clean it up and be able to use it. That's really one of the key things. We're making that available for free. So you'll be able to pull it off of GitHub and put in your own environment. If you want, it'll be compatible with AWS and Azure. We'll probably offer some, managed service to, if you want, us to warehouse it, but that's going to be freely available and is a really critical part. And then when it comes to that critical decision of who you're working with, this is so important. These are a few of the questions that are in this template. We found up to 17 undisclosed revenue streams that the employer had no idea about. And that's one of the other really critical elements in the CAA is getting the compensation disclosure form and completing that, submitting that. And if you have a consultant that has not told you about that, that is an enormous red flag because that is something they know about. And unfortunately, it creates kind of this awkward situation sometimes. It's sort of the business equivalent of finding out your spouse cheated on you. There's very large revenue streams. The latest class action suit that was filed, it's widely known amongst people in the know that the PBM coalition they were part of, that benefits consulting firm makes over $500 million on that. So these are the sorts of things you have to dig in and get after it because there's real opportunities. So we're releasing these things at Rosetta Fest. This is our annual gathering where we celebrate the best employee health plans in America. These are the people with the high health plan grader score. They are the ones who produce the Health Rosetta dividend. They all have very much a giver mindset. They want to share their success. And so we have a couple hundred employers that will be there, and the solutions to work with, a very aligned people, set of events. And one of the analogies we've used a lot is with the built environment, because and the U.S. Green Building Council LEED standards, because the built environment is kind of like healthcare. There's a very local, very entrenched industry. Sandy Wiggins, who was the chairman during their hyper growth phase, came to our event last year, and it was very gratifying. He said it was like 2002 when this movement really took off. So invite you to join the event. If you can't make it in person, we'll have all access virtual. And really grateful to Leah and Leapfrog for giving us this opportunity. So I will stop my sharing and
Great.
pass
Thank
the
you, Dave.
baton to Melissa.
Bring up Melissa Bartlett, Senior Vice President of ERIC. Thank you, Dave, for that. And I just want to point out to people that all the resources that you just named in your presentation, of which those are golden, including that open source, I guess it's not, well, the open source RFP is just amazing. So I'm very excited that you have that available. And I'm going to hand it to Melissa now. Thank you for being with us.
Thank you. And thank you, Leah. And it's nice to join you, David. If you want to advance to the next slide, I think what I'll do, just take just a few moments. I know we're coming up to the end of the presentation time, and I want to leave time for questions because I'm sure there's a lot. I know I have a lot after Leah and Dave's presentations, but I'll pull it back a little bit. I think when I was asked to be part of this really great panel, one of the lenses that I could bring forward is the context by which Congress is thinking about ERISA right now and potentially into the next Congress in the future. The last, as Leah sort of laid out, CAA really was a pretty big deal when it passed, and it was a pretty important part of changing when it comes to ERISA law, to reflect the need for more transparency and more data sharing, specifically among employers and their third-party vendors. But I do think it's important to sort of gut check where we are today, right? In this overall sort of discussion point on ERISA, particularly given the fact that it is the 50th anniversary of ERISA. And yes, I was an ERISA baby. I was born the year ERISA was enacted. And there's a lot of heightened attention now because, ERISA serves as such an incredibly critical tool for multi-state employers to be able to continue to offer uniform benefits in an affordable manner across multiple states to all of its workforce. And maintaining the strength of ERISA, particularly the strength of ERISA preemption, is crucial for self-funded employer plans, those of whom my member companies offer. So, Congress has really taken this moment in time and taken an interest to really build upon and strengthen this law in regards to health benefits. And the House Education and Workforce Committee, the chairwoman, Virginia Fox, issued an RFI, right at the start of this year that includes several key questions related to preemption and fiduciary requirements and reporting requirements and cybersecurity and others, ways that could, take what has happened to date, including the CAA provisions, and build upon them or tweak them or improve them. The committee held its first hearing. It focused on preemption. We think there's probably more hearings that will come as the committee staff continue to sort of work through all the responses they received from the RFI. Eric filed a response to the RFI. I'll talk about that in a minute. Probably not, Congress now is going into its August recess, so probably not until the fall. But, we do think that these hearings can lead to something. There could be a legislative package. It's unlikely to be completed by the end of this year, but it does sort of set the stage for continuing conversations into the first half of next year. And, again, in 2025, it's going to be a new Congress. Chairman Fox will no longer have the committee gavel. She's term limited. So it's a little unclear exactly who will be in charge and which party will be leading the directives. But I think ERISA is one of those topics that is bipartisan, bicameral, and it once the momentum is there to start looking at ways to improve and strengthen it, I think the work will continue. So if you want to go to the next slide, I mentioned that Eric had issued a response to the RFI, and you'll see it here. There were sort of a bunch of questions. I think there was like 100 different questions across a whole variety of categories of which ERISA could be approved upon. Eric, we chose to identify sort of these 5 issue areas, knowing what we hear most often from our member companies, where there's ongoing angst about changes or ongoing directives to go out and get changes made. So, it's preemption. Obviously, our core mission is to protect and uphold the principles of ERISA preemption. We've seen a lot of state laws that crop up and really encroach on the federal law and the preemptive effect of ERISA in recent years, post a number of Supreme Court decisions. And so, again, we will continue to try to preserve and reinforce ERISA preemption and defend the plan sponsor's ability to design benefits that drive value. Additionally, there are, I think, of this list, in the interest of time, I'll just mention a couple of things. So first, I'll skip ahead to reporting, and you'll see under the reporting section here, if you look down to the second and third bullets in terms of what we chose to focus on and what we continue to advocate for with members of Congress and the agencies, quite frankly, because there still is a lot of ability of the Department of Labor and the sort of tri-agencies to really do some clarifications around some of these CAA provisions. But you'll see that we have focused on, in terms of how to enhance ERISA reporting requirements, looking at the compensation, transparency, and disclosure requirements that were in fact put forth under the CAA. Those are the PBM consulting subsidiaries need to be subject to the CAA requirements. The gag clause attestation requirements continue to prove to be a big issue of concern for large employer plan sponsors, as they did their attestation at the end of last year, and I fielded many questions from member companies calling me saying, I can't get the data I need to sign the certification, Melissa, what do I do? And there's a number I can file a complaint at the DOL. Is that my only recourse? And I say, sadly, yes. Go ahead, call the number. If you feel brave and you want to do it, great. But it really presented a challenge for a number of large employers in terms of meeting their certification and attestation requirements under the CAA law with regards to gag clause attestation, with really not being fully confident in what they were attesting to. And that goes to a broader question around claims data access and all of that. And then also, I would probably note in the data sharing, again, we think that there are ways to improve upon the transparency and coverage provisions. We think you could require the use of API. We need to move away from default paper anything. We think encouraging electronic reporting is important. Increasing the reporting frequency, consolidate all of these different reporting tool pathways that are now sort of cropping up and being implemented would be very important. We continue to push for greater healthcare transparency across all payers, across all providers, including PBMs. And so we've supported different House and Senate pieces of legislation that we believe would accomplish that. And then a quick word about fiduciary responsibility. So, Dave, since you highlighted the issue with the lawsuits, so Eric continues to say one of the probably cleanest, most straightforward way to potentially head off the bad practices that we see, third-party vendors reportedly engage in, right? When they are, performing functions on behalf of a plan sponsor, is to essentially say, to make the clarification in ERISA law that when these third parties, whether TPAs or PBMs, are under contract with a plan sponsor and performing a function on behalf of that plan sponsor, they really are subject to the same fiduciary duty to the plan that the plan sponsor is. That in the end, they shouldn't be doing anything that you yourself couldn't be doing, right? And fiduciary duty is not as complicated as a lot of folks make it to be. It's really quite simple. It comes down to sort of two general principles. One is that you have to save money for the plan. Two is you have to do the right thing. And so you would expect any contractor that's building your networks, that's developing your formulary, to be doing those two things, right? So I do think that we are very sensitive to and monitoring from the employer lens, you know, the acceleration of and proliferation of some of these lawsuits. But I do think a way that Congress could really head this off is to just make that clarification in ERISA law, so that then hopefully the people who are acting on behalf of large employer plans will self-police. They'll do the right thing. They'll be held to the fiduciary duty to save money for the plan and to be doing the right thing by the plan beneficiaries. If you want to go to the next slide. So I mentioned quickly sort of the context of what Congress is looking at doing by the year end. And at this point in the game, it's everybody's looking to see in a lame duck, will there be a legislative vehicle that will be opened up to healthcare policies? I know Eric and a number of employer organizations are pushing hard that we don't miss that train if that train comes up. It's a bit of a question mark because it is an election year and things have been quite chaotic and stressful, I think, for members in Capitol Hill. So we'll see what the political will is to really take on a large legislative vehicle in the lame duck before the end of the year. But if there is that vehicle, I would anticipate seeing some machination of these three bills. So the Lower Cost, More Transparency Act bill is the House bill. It passed by a huge vote, over 300 votes, a while ago, and it's been sort of hanging out there. But that codifies the hospital transparency requirements, and it extends, enhances the transparency and coverage requirements for plans. It creates transparency requirements for PBMs. It includes a number of other anti-consolidation fair payment policies around site neutral payments and honest billing policies. And then on the Senate side, the Senate Health Committee bill, the Section 1339, again, that passed out of the Senate Health Committee by a very big vote as well in the spring of 2023. So it's sort of parked and sitting there. And it includes, again, it's focused on PBM transparency. It doesn't include all the hospital and plan things and other reforms. And that has been strongly supported by Eric and a whole host of other organizations, calling on the Senate leaders to really put their support behind that being included in a year-end bill as some of the most meaningful to date PBM transparency and what I would say accountability reforms that they could proffer. And then the third is just a note, that's the Senate Finance Committee has sort of been working within its jurisdiction, which is not in the commercial market like the large employer market. It's really in Medicare and Medicaid. So their package that they put together of PBM reforms really is focused on Medicare and Medicaid. However, they really were the first to sort of open up this concept of delinking PBM revenue from the fees that are assessed by PBMs upon drug manufacturers when they start putting together their formularies. And I will say that there's been a spillover effect there into the commercial market now. I would anticipate that the sort of delinking concept could also be included in a year-end package. I know that, Eric, we've been pushing that some form of legislation that would incorporate that policy of delinking that revenue be put in addition to the 1339 and the HR 5378 reforms altogether, if possible, in a year-end package. If you want to go to the next slide. So speaking of the year-end package, I think it's good just to build out a little bit more about some of the themes we've seen emerge, particularly in the House bill around, having heard from organizations like us and Leapfrog and others, Dave, I'm sure you're in the group too, about sort of the ongoing need for clarification around the CAA provision so that they can be implemented by employers in the way that they were intended to be. And these include, again, there's a study in that Senate bill I mentioned, not the Medicare finance bill, the Senate Health Committee bill, that requires the Department of Labor to look at what would be the impacts of redefining PBMs as the fiduciary duty within ERISA now. I would argue at this point, we should go beyond the study, particularly now that we see more and more of these lawsuits coming up. But I'll put a pin in that. And you'll see some of the other things that we hear about all the time from our member companies, questions around PBMs as consultants. Will brokers and consultants be required to disclose direct or indirect compensation received for referrals? Making gag clause teethier, right? Making sure that the data is actually shared among the parties to these gag clause requirements. Enhancing the audits, again, prohibiting insurers, PBMs from sort of blocking certain consumer decision support tools. Again, and I can't underscore it enough, the importance of enrollee data transparency, doing API, all of those things. These are ways that you can really build upon the CAA and enhance it and hopefully make it work. And just so you know, it's not just Congress. I know, Eric, we've again, delivered these messages to the Department of Labor. We've asked the Department of Labor for more clarification around, for example, the gag clause concerns, and it just really hasn't been forthcoming. So if Congress isn't able to actually take some of these steps, the agencies under whichever administration is in place next year could take it up and do something with it as well. And then if you want to go to the next slide. Oh, a quick couple seconds. I'll just say, there are a lot of things that employer plans are right now very focused on. I think a number of these all have, feet, so to speak, in the CAA requirements, but we anticipate that it's not going to get any easier for employers to offer health coverage, of which nothing requires them to do. To your point, Dave, it's getting more and more expensive. So can we find a way not to add to that value equation, making it so expensive that it tips the scales? There's a number of folks out there that are going to want to continue regardless of the administration, regardless of who controls Congress, the discussions around health plan alternative coverage, whether it's ICRAs or association health plans. Of course, Eric is going to continue to oppose all employer plan mandates. We've been very involved, for example, on a campaign around asking the administration not to finalize a very unworkable set of rule changes to the mental health parity and substance use disorder law that would, I think, just blow the roof off of medical management and increase employer costs significantly. Transparency will continue to see that happen. This is not a one and done. Even if things happen in the year-end bill, and we hope that some of these CAA fixes are included in this year-end bill. If there is a year-end bill, there's still so much more. We're just scratching the surface on what kind of information sharing is necessary to really capture the real value that employers need to fulfill their fiduciary duties to their plans to be saving the plan money. And then, of course, healthcare costs. That will continue to be a primary concern for employers as they look into 2025. If you want to go to the next slide. And I think that's it. I did want to say one thing, Leah, before I turn it over for questions. I really liked on your slide where you said what employers should expect from TPAs and consultants. And you said contracting principles aligned with employer interests. So one other thing of note is that I think members of Congress are very, very interested in sort of the multi-plan experience. So for those who are not aware, the New York Times did an investigative reporting piece on multi-plan and how multi-plan assesses fees with employers to drive lower costs for provider networking and provider reimbursement. And there has been a substantial, I would say substantial interest from members of Congress on this and this kind of model to allegedly drive savings. I will say that employers do, in my experience, do not like what's going on. And I would anticipate, given comments made by Senate Finance Committee Chair Ron Wyden recently, ongoing sort of investigative measures that committees of jurisdiction across both chambers are looking at in terms of letters requesting more information, multiplan and others. I think that I would expect that tent to broaden a bit. And I think it's not just sort of like, what is this business practice of one company multi-plan? I think it's causing members of Congress to really think about this space and the practices that are associated that could be employed by any number of companies that are working with employers to try to sort of mitigate growing healthcare cost pressures, but looking at that space specifically. Are we underpaying providers? Are we paying for less than value providers? What are these fees that are being assessed? So I would predict that even going into this fall and into early next year, that this issue may not just go away quietly. I think it's just, again, shows that there needs to be more transparency across the system in order to really assure that patients are being treated safely and in a cost-effective way. So I will turn it over for.
Great, thank you. Yeah, I agree. I think fundamentally transparency is really the first. I think it's the first step. That's the first principle and the first step, really, that any employer needs to take as they grapple with this legislation. It's just under ERISA and under this, the most important thing that an employer has to do is show they're making an effort. I mean, actually, that's really the key, is you're trying. You don't always have to succeed, actually, under ERISA, but you got to show you're trying. And so transparency is always a good way to do that, no matter what, enforcing it in your contracts or transparency in just how you relate with your employees and give them the information they need to make good decisions about their care. All of those things are going to put you in at least in the right direction, and certainly protect you in many ways as we see so much more coming around this particular legislation. And I mean, in the future, the changes that you just outlined, Melissa, I hadn't been aware of how many there were, how much thinking has gone into really what may be a real overhaul around ERISA. So it's very exciting to see. And unfortunately, we're not going to have too much time for questions. There's one question, there's two actually that have come up from the audience. One about a rural employer. If you only have one single local hospital, what do you do around quality? And I will just say this: I've lived in a rural area. Again, you have to try and show you're trying. So that means report to your employees on what we know about the quality and safety of that hospital. You can get that from Leapfrog, and then meet with the hospital and encourage them to show improvement as your employees look at that data. It will work. We've seen it over and over at Leapfrog. Just simply having that conversation and saying that you as an employer are watching their performance as they compare nationally will show improvement. You will see they will take that seriously, and you will see the improvement. Even if it's just one hospital, we've seen it over and over again. So don't give up just because you only have one. And so let me ask,
Leah, can I just add onto that? Absolutely that. In the meantime, plan design that allows you, to send people to the highest quality place for $0. We have that all the time. One hospital towns, low quality. We have the data, and we say you can go there, and you're going to deal with all the normal, high deductibles and bills and all that madness. Or if you're willing to drive 2 hours, there's a great facility, and if you go there, the price will be $0. Like, that's a straightforward plan design thing that a lot of employers are doing now.
yeah, that is another option. I think sometimes employers might be hesitant to go that far, and if they are, simply report it and start there. You will find you'll get traction no matter what you do, but try. You need to do something. Certainly that will be most helpful to you under this law. So I'm going to ask a quick question. We have like 2 minutes left, but what's the first thing employers should do to be ready for all of what's coming with the CAA? Melissa, I'll start with you.
Oh boy, I was going to say, start with Dave. He's the one that's developed all these great templates and models, right? I mean, go to Dave's website. I was writing it down myself. That's the thing, is that there hasn't been really forthcoming from the agency clear guidance. Like, this is how you comply. This is how all of this is going to happen. And some of it is still very much an open question. I argue maybe some of it could, now that we've had the Chevron decision with Loper Bright, do some of the sort of regulatory policies that the administration has put out, their interpretation of CA, do they stand? I don't know if anybody's going to challenge them, but I think it will make them, I presume, a little bit more conservative in how much they are forthcoming in directives given this backdrop. But it's not like we've gotten a whole lot yet to date either. So kudos to groups like yours and Dave's for really helping facilitate some basic compliance tools that are so critical.
Yeah, I echo that. But thank you to you too, and Eric, because I know you've been really important leaders on not only on this legislation itself and where it came from, but also really watching closely where it evolves to as ERISA goes forward. Very, very important. And you've put some really good thinking into it and given us important leadership, and really good leadership for employers, because we really need some innovative thinking about how we want to see the future go. So I do appreciate it. And Dave, what's the first thing?
Yeah, I mean, I would really, recommend starting with that that consultant advisor RFP. Everything fans out from there, right? If you don't have that relationship right and the right type of disclosure on direct and the indirect is where a lot of the perverse incentives get baked into plans. That is just a really important place to start. Some of you may know about Equity Healthcare. That's Blackstone's group. They have this group that does it. That's always the first thing they do. They put out a RFP for their consultants, and most of the time there's a shift. And so we'll make that. We've had that tool used for several years internal to our community. That's kind of our approach is we battle test it within our community and then eventually open source it. So, next month at Rosetta Fest, we will open source that. Obviously there's Health Rosetta advisors that have access to that in the meantime. But that's so much fans out from there. And, the plan grader, I put in my email, dave@healthrosetta.org. I'm happy to share the 40 questions that are in that plan grader. And people have told me, many employers, gosh, just reading those questions was actually really educational. So happy to share that as well, because that also is battle tested over many years as to what was most important. And it's essentially a summary of all of what's in the contracts and plan documents that works well. And it boils it up to the high level.
That's so helpful. Thank you. Unfortunately, we're out of time. We do have another question, which we'll put comment and answer on the final materials for this webinar, which you'll get a link to that in your email if you're signed up for this. And it's also the full, all the resources are on the leapfroggroup.org website, where you will find this recording for this particular webinar, but also for past webinars on the same subject, and lots of other resources and links to what Dave was just talking about, and certainly the good work that Eric has done as well. So thank you for being with us today, and thank you to my guests, Dave and Melissa. Thank you both for these amazing insights. This has been very, very helpful. Thanks, everyone.
Thank you.